Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Klinefelter Syndrome. Introduction. Klinefelter Syndrome is a genetic condition that happens in men. The most common symptom is infertility. It can also affect different stages of development. Klinefelter syndrome can be hard to diagnose, but it is important to start treatment as early as possible. With treatment, most boys grow up to have normal lives. This program explains Klinefelter syndrome. It talks about the symptoms and causes of the condition. It also covers diagnosis and treatment. Klinefelter syndrome. Klinefelter syndrome is fairly common. It affects about 1 in every 500 newborn boys. Klinefelter syndrome happens only in men. Women cannot get Klinefelter syndrome. It happens when an extra X chromosome is found in most or all of a man's cells. Only 10% of males with the syndrome are diagnosed before they reach puberty. Puberty is the time in life when a boy or girl becomes sexually mature. For boys, it usually happens between ages 12 and 16. Klinefelter syndrome can affect how much testosterone is in the body. Testosterone is a hormone. It is responsible for most of the changes a boy's body goes through during puberty. This is why diagnosis is more common after puberty. Most men are diagnosed with Klinefelter syndrome when they get treatment for infertility. Many men never find out that they have the condition. Women who are pregnant after age 35 have a higher chance of having a boy with Klinefelter syndrome, but the risk is only slightly higher. Causes. Klinefelter syndrome is a genetic condition. This means that it happens when an abnormal change takes place in a male's genes. Genes tell the body to make certain substances. Every person has thousands of genes. Our genes make us look the way we do. They also have a lot to do with our health. Genes are found on chromosomes. Each person has 23 pairs of chromosomes. One of these pairs is called the sex chromosomes. This pair determines a person's sex, meaning if a person is male or female. A baby that has 2 X chromosomes, or XX, is female. Male babies have 1 X chromosome and 1 Y chromosome, or XY. Klinefelter syndrome causes a male to be born with an extra X chromosome. This means that most males with Klinefelter syndrome have 2 X chromosomes instead of 1, or XXY. Often, the extra X chromosome is found in all the cells of the man's body, but sometimes it is only found in some cells. Rarely, Klinefelter syndrome patients can have more than 2 extra X chromosomes. The extra X chromosome may come from the dad's sperm or the mom's egg. It may even happen after the sperm and egg have joined while the baby is growing in the womb. Doctors are not sure what causes the extra X chromosome in some males. It seems to happen by chance. Children do not inherit Klinefelter syndrome from their parents.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. The most common symptom of Klinefelter syndrome is infertility. Nearly all men with the condition are infertile. Klinefelter syndrome can also cause a small penis, breast growth, less facial and body hair, low energy levels, smaller muscles, small testes, unusual levels of some hormones. Sometimes problems at birth may be a sign of Klinefelter syndrome. For example, a newborn boy's testicles that have not dropped into the scrotum can be a sign. Young men or boys with Klinefelter syndrome may be shy or socially awkward, tall with long legs and a short torso, uncomfortable in social settings. Klinefelter syndrome can also cause speech and language problems. Males with the condition may have trouble using language to express themselves. The condition can also cause learning and reading problems. Adults with Klinefelter syndrome may have difficulty solving problems, low sex drive, problems getting or keeping an erection. Some men with Klinefelter syndrome have very few signs or symptoms. They may only have one symptom, such as infertility or very small testes. Complications. Men with Klinefelter syndrome are also at an increased risk for certain health problems. Some of these include certain types of cancer, including breast cancer, lung disease, such as chronic bronchitis, osteoporosis. Having Klinefelter syndrome also raises the risk for certain autoimmune disorders, such as lupus, rheumatoid arthritis, Sjogren's syndrome. Klinefelter syndrome can cause extra fat to be stored around the abdomen. This raises the risk for heart disease, blood vessel problems, type 2 diabetes. Diagnosis. Your healthcare provider will first ask about your symptoms and medical history. He or she will also perform a physical exam. There are two main tests used to diagnose Klinefelter syndrome. 1. Hormone testing. 2. Chromosome analysis. Hormone testing is done to check the level of certain hormones in the body. Klinefelter syndrome can cause unusual levels of some hormones. Blood or urine samples can be used to test hormone levels. Chromosome analysis can confirm the diagnosis. First, a blood sample is taken and sent to a lab. The sample is examined to check the chromosomes. Men with Klinefelter syndrome have an extra X chromosome in most or all of their cells. Treatment. Klinefelter syndrome cannot be cured, but treatment can help reduce the symptoms and complications of the condition. Most males with Klinefelter syndrome do not make enough testosterone. This can cause a number of problems. Testosterone replacement therapy can help. With this therapy, testosterone is given to replace what is not made in the body. Testosterone may be given through injections. It may also be given in other forms, such as implantable pellets, a gel, or a patch on the skin. The treatment can help boys go through puberty. It can also improve bone strength, increase muscle mass, and reduce breast growth. Other treatments depend on symptoms. For example, some men with Klinefelter syndrome have breast growth. Surgery can remove this extra breast tissue. Some boys with Klinefelter syndrome have language or learning problems. Speech therapy and special education can help. Physical therapy can treat muscle weakness caused by Klinefelter syndrome. Most men with Klinefelter syndrome are infertile. This is because no sperm are made in the testicles. But some men may make a small amount of sperm. In these men, certain fertility treatments can help them father a child. The child is unlikely to inherit Klinefelter syndrome. There may also be other options for having a child, such as adoption. Some couples choose to use donor sperm. Talk about your options with a healthcare provider if you have fertility issues. Some boys or men with Klinefelter syndrome also benefit from counseling. A counselor helps a person work through emotional issues.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Klinefelter syndrome is a genetic condition that happens in men. The most common symptom is infertility. It can also affect different stages of development. Klinefelter syndrome is fairly common. It affects about 1 in every 500 newborn boys. Klinefelter syndrome causes a male to be born with an extra X chromosome. This means that most males with the condition have 2 X chromosomes instead of 1. Doctors are not sure what causes the extra X chromosome. It seems to happen by chance. Children do not inherit Klinefelter syndrome from their parents. Men with Klinefelter syndrome are also at an increased risk for certain health problems. This can include certain types of cancer, including breast cancer, heart and blood vessel problems, lung disease, osteoporosis, some autoimmune diseases such as lupus, type 2 diabetes. Klinefelter syndrome can be hard to diagnose. It often is not diagnosed until puberty or later. But it is important to start treatment as early as possible. With treatment, most boys grow up to have normal lives. Thank you for using Explain.